you are and what you do.
Hi, I'm Dr. Jameelah Nelson. I am based in Atlanta. I'm a naturopathic doctor, expert in natural medicine, and postpartum specialist. In my private practice, I help new moms restore balance so they can step into motherhood with a renewed sense of confidence, energy, and joy.
Excellent, excellent. And Dr. Devin.
Hello, everyone. I am Dr. Devin Miles. I provide natural solutions in the areas of prevention, gastrointestinal disorders, and kidney disease. So I help clients to reduce things like gas and bloating, indigestion, and with that, they tend to experience an improvement in their mood. And then on the kidney side, I help people to experience stabilized kidney function and improved kidney function. And in the areas of prevention, of course, I help healthy people to maintain healthy lifestyles, as well as prevent the other two niches that I spoke of. So helping people to address things like hypertension and diabetes that put them at high risk for kidney disease so that their kidneys are protected and they don't have to deal with kidney disease at the same time.
Excellent, excellent. And I am Dr. Turshá Hamilton. I'm currently in New Orleans, Louisiana, and I am passionate about helping people with diabetes and hypertension to live better. And on top of that, I am just really a fan of sharing naturopathic knowledge, my naturopathic colleagues, with as many people as I can, so that we can help affect change in the community, in our various communities, and make sure that we are all empowered with enough information to start to take control of our health and live healthier lives. And one way that we can do that is to have discussions about various topics. And so that's why today we're going to talk about lactation and breastfeeding. So the very first thing, those of you who are watching, welcome and thank you. Go ahead and share this video because there might be a new mom, a new dad who needs to know more about breastfeeding, its benefits, the trials and tribulations that occur with it, and some of the things that they can do to help the process along. Because breastfeeding is not necessarily easy, definitely not always easy. And so we want to give as much information and knowledge as we can. So again, make sure that you share the video so that somebody can get some help and breastfeed easier. So, Dr. Jameelah, why is it important for a new mom to breastfeed her baby?
I didn't hear what you said. My internet is.
Your video is muted.
Can you repeat the question?
Oh, yeah. Okay, so why is it important for a mom to breastfeed her baby? Did you hear me? All right. Dr. Devin, jump in. Let's talk.
Yeah. All right. So it's important to breastfeed the baby because that is where they start, well, after they get delivered vaginally, the next part is to supply them with the nutrients that they need to grow and to build their immune system properly. Colostrum is a component of the breast milk that is part of that immune support that the baby needs as they develop. So it's also highly digestible. It's a highly digestible source of nutrients for the baby. It's the best thing that they can have. Formula is kind of like a substitute, but nothing compared to what breast milk can do for a baby. So that's why I definitely find breastfeeding to be the #1 source of nutrients, the best source of nutrients that you can give to a developing child. And it also helps support, when you support and build a proper immune system as a child, that helps you for the rest of your life. It's very obvious as I work with adults that the ones that didn't, or even, older adolescents, the ones that didn't get breastfed, they tend to have issues. It's not everyone, but that can be a component in as to why they may be struggling more than some of their peers. And so providing them a great foundation through breastfeeding, I think is a great way to go.
You hit on a lot of different points that are really important that people may not necessarily think about. So let's kind of talk about that. So first things first, breast milk for whatever animal you're talking about is always going to be better for the baby of that animal. So the
Yes.
breast milk for a human is designed to better serve humans. Breast milk for a cow, breast milk for a goat, breast milk for a camel. Those animals don't grow at the same speed as a human. So breast milk or milk from those animals are not necessarily going to work the same way. They're not going to be as easily digestible. They're not going to have the same amount of nutrients, the same consistency of nutrients. It's just not going to be optimal. They obviously work as a substitute. It's just not the best substitute.
Right. Yeah, and if you are going to substitute, I'm still always going to encourage my clients that are mothers to find the best thing. And what I mean by that is that they're finding something that is not creating more gas and bloating and crying for their baby. It's not something that's going to make them more fussy. You know, it's got to be something that you can tell that your child is tolerating this well. They're not breaking out all of a sudden all over their skin. You want to find that this is working well. Their behavior is still calm, or is still the same. Their skin is still the same. Their bowel movements, their GI tract, everything is still as close to normal and healthy as possible if you stray from that. But reality is, if you can breastfeed the whole time, that is definitely number one.
Dr. Jameelah, how long should a mom consider breastfeeding?
I would say as long as a mom would like to. There are certain recommendations, such as like the WHO recommendations, which are about, normally they say about 2 years. But as long as a mom can breastfeed would be ideal, because breast milk is very nutritious. It sets the children up with a really great less allergies. A lot of the common illnesses, they have less of those things when they're breastfeeding. It's very nutritious, and so I would say at the least a year, but 2 years is ideal, or longer if possible.
Okay, longer. So I've seen, cases where children are 3 years old or more and they're still breastfeeding. That's okay? Dr. Jameelah?
It is definitely okay. I know that common society is a lot of times against a child if they're breastfeeding, especially if they're not like an infant, or if they're over the age of, if they're walking and still breastfeeding. But breast milk can still have a lot of nutritional values.
Oh, she froze
All
again.
right, she froze again.
I would, when she comes back on, I will let her continue with that question. But yeah, I mean, like, I have one client whose child is over 2 years old and still breastfeeding, still everything's still going fine. So I just, as long as she wants to keep doing it, she's still within that age range for the child that I'm like, yeah, keep going. So I don't have, I think, unfortunately with society and how we change and how we evolve and what we do based off of convenience, because it becomes a norm and we no longer understand what healthy is versus norm all the time. And so I think that's something that we have to re-educate ourselves on, what is actually healthy for a child versus what, society's trend is at the current moment.
Okay. That makes sense. We were having a completely different discussion, but it's still me and some colleagues, but it still ended up being that topic, that what we consider normal is not necessarily what is best,
Right.
because society sort of decides what is normal. Normal is based on what is common, right? What is acceptable. But that doesn't necessarily mean that it is the best thing that's, the best thing for the parties involved. So for those of you who are watching, keep that in mind, that normal doesn't necessarily mean it's right or that it's best. It just means that it's common. And as they said, the longer you breastfeed, the better, because mom is producing and providing the nutrients that baby needs. One of the things that I found fascinating, and I actually saw this on a Facebook post, was it was a picture of a side by side of two aliquots, two samples of breast milk that a mom had pumped, and one was regular color, and one was like a kind of a greenish color. Like, I don't even remember what color it was. But mom was saying that in the post, that the one that had the color tint was what she produced when her baby was ill. And it was awesome because it got me to thinking about that. So when baby is ill, um, whatever baby is producing or fighting is going to sort of interact with mom. Mom's immune system is going to respond to that and then be able to produce immune factors that can then be given back to baby to help baby fight off whatever it needs. And so,
Amazing.
what'd you say?
So that's pretty amazing.
It
It
is.
it it goes back to the whole, the more that we see these observations, but the more that we can see the connections between the body of the baby and the body of the woman responding to each other, communicating to each other in that moment of breastfeeding.
Yeah. And, just having that as an example, a pictorial example of, what happens, the changes that can happen when a mom is breastfeeding in the instant that a baby is ill, was really powerful for me. And it just reminded me of how intelligent our bodies are. We have to remember that we have this innate intelligence about us, that modern society, unfortunately, gets us to ignore a lot of times, right? And that goes back to what we see as normal is not always the best, because what we see as normal is just what we see all the time. Dr. Jameelah, what are some of the some of the amazing things that you've seen or known about breastfeeding? What tell us something that you just thought was amazing about breastfeeding and what happens in the process of breastfeeding. Can you hear me? Dr. Jameelah? All right. So, all right. Um, Dr. Devin, you talked about colostrum. I know a little bit about what colostrum is. What is it? Because
It's
I don't really,
essential.
yeah, I haven't really studied it a lot. What is it?
So at a minimum, it's a lot of immunoglobulins, a lot of immunotherapy that the body's baby needs to develop its own immune system.
Mm-hmm.
So the mother and the baby connection is important, not just from a bonding standpoint, but also what the mother is supplying the baby so that that baby can grow properly. There's a lot of things that can go wrong or awry if a baby's immune system is not in balance. We
Mm-hmm.
see that in terms of an underactive immune system, an overactive immune system, and so when the baby has what it needs to have a balanced immune system, it can deal with a lot of the environmental insults, whether it be the food we eat, the air we breathe, and all that, it has a foundation for how to deal with that better if it gets the immune factors that are within colostrum.
Yes, yes. Just to recap, for those of you who are watching, I don't even think I mentioned this. August is actually Breastfeeding Awareness Month. This is one reason why I wanted to have this conversation about breastfeeding so that we can share a little bit of information about it. Now, I will tell you that there were supposed to be other docs on the video today, on the call today, but things happen. So Dr. Kalina, who actually is a midwife, got a call. One of her moms started having contractions. So yay, mom, new baby is on its way, which means she couldn't join us. And as you guys can see, Dr. Jameelah is having technical difficulties, and there's a couple others. So just know that we're going to give you the information. It's Breastfeeding Awareness Month, and we're going to talk to you from our experiences. And we might have to do another breastfeeding talk, just so that we can try to get the other experts on and discuss the topic, because it is an important topic, you know, it is an important topic. A lot of people are not understanding the relevance, the benefit, the gravity of breastfeeding. Like literally, you are carrying around your baby's food, right? Literally. So yeah, that's sort of important. You talked about allergies. What are some of the things that you've noticed? Specifically, you mentioned that, you know, it kind of sets baby up for the rest of their lives. What are some of the things that you noticed about, you know, adults who had not been breastfed?
So because of my specialty in gastrointestinal disorders, I see a lot of clients that come in with chronic digestive issues. And when they have that, they can also have their hormones are out of balance. They could be having low thyroid function, so like hypothyroid. They have a lot of food sensitivities. They may have had a lot of food allergies, significant PMS or abnormal periods. And so it's like their system is just kind of off. And so they're just struggling all the time and every month, you know, because of their cycles. It's just, and then on top of that, they're tired. So they're dealing with all these various symptoms that are demanding a lot of them. And then on top of that, they're weak and tired. And so their immune system is just trying to fight in whatever way it is, whatever way it wants, whatever way it thinks it can. And it's obvious that something is a bit off, and they're not grounded really in their immune system, and they're not per se grounded in how they feel about what's going on in life, or how they feel within themselves internally. And I think part of their immune system, in terms of its connections to everything else. The other thing is that the immune system, about 75% of it, is within your digestive tract. So on top of that, we can also go back to the fact that I may ask the question, were you vaginally delivered? And if the answer is no, that's another part of your immune system that you miss, because the vaginal flora helps to coat the baby as they come out through vaginal delivery. And that vaginal flora or bacteria is a source of good bacteria that is also important for our immune system. And so what I'd like to go into, and this kind of goes back to what I was saying before about a lot of my clients, when they first start with me, they're kind of weak and tired, and then having all these per se, what feels like excess symptoms, but they are also quite depleted. And so I just want to keep that word, once you keep that word in mind as I talk about what hypoprolactinemia means. And so when we talk about breastfeeding, one of the things that is, we talk about it being so important, but then you start to breastfeed and then you may have trouble. And so I have also had clients who had issues breastfeeding even though they wanted to. And so there's two particular reasons. Well, there's a few reasons for that. One is you just don't create enough milk, or you are having trouble getting the baby to latch on, or you're in pain and so it's just not appealing to you anymore. So what I wanted to talk about was lack of milk supply, and to go into that a little bit. And then you can see where this may even come back to what I said about depletion. So prolactin is a hormone that helps you to have proper milk production. So when I say hypoprolactinemia, I'm talking about a state of where you hypo, like hypothyroid, not enough thyroid function. Hypoprolactinemia is where you're not producing enough prolactin. So that can be associated with a number of different things. Ovarian dysfunction in women. In men, it could be metabolic syndrome, anxiety symptoms, arteriogenic erectile dysfunction, premature ejaculation, low concentration of semen, reduced sperm motility, hypofunction of seminal vesicles, hypoandrogenism. So you have just less male hormones around. And then also hypoprolactinemia can result from autoimmune disease, hypopituitarism, growth hormone deficiency, hypothyroidism, as well as excess of dopamine or ingestion of drugs that activate what's called a D2 receptor that helps to enhance dopamine. And so through everything I said, what trend you might be gaining from that is that not enough prolactin can come from other symptoms or states. It can be associated with other states of depletion. There's some low functioning going on in general, probably within the system, that's creating a low prolactin state, which then could translate to you not producing enough milk. And so this is also what I see with my digestive clients when they first start. Their body is, their immune system has gone awry, and it's attacking things that it shouldn't be attacking because the terrain of the intestines is not stable. It's not functioning as it should. It's missing certain things that it needs to create the barrier, to not let certain things leak out into the blood. It's lacking the enzymes that it would normally produce. And so it's like this deficiency state with some excess at the same time. And so I've seen this is where your immune system is out of balance, and so you can have these deficiency states and these excess states all at the same time. And so what I see in this is that there might in fact be a continuation of depletion that the mom had, and then there's this continuation of depletion into the child. And so one of the things that's important when we're talking about milk production is making sure that the mom herself is at a high functioning state. So that means that she's eating good food, for instance. When a mother is breastfeeding, right, and the baby's just first born and you're raising the child, you could easily get into bad habits because you're so tired, right? And you're just trying to keep up with everything. But it's important to have a healthy diet because you need the nutrients to keep your immune system in balance. You need the nutrients to keep your hormones in balance, and that includes prolactin. And then there's two particular hormones that help to regulate prolactin, and one is dopamine. If you have too much dopamine, you can actually decrease prolactin. So that's, again, going back to if you're ingesting drugs that, ingesting medications that enhance dopamine, you have to be careful not to reduce prolactin. Estrogen can actually help it to increase prolactin. That doesn't mean go out and just like boost yourself with estrogen. I'm just saying that's kind of part of how prolactin works. So
Okay.
that's just the hormone part.
Okay. So it's important for us to realize what you just said, or all that you just said. Basically, that breastfeeding is one of the things that's really important to set you up for the rest of your life. Your health as an adult sort of depends on your birth story as well as how you were fed as a little one. Now, that's not to say, moms, if you are not able to breastfeed, if you adopt a child, if you have to work and you can't breastfeed all the time, that you did something wrong. We're just letting everyone know that it really is important that if you are able to breastfeed, please do, because it does set you up for better health later on down the line. You talked about a lot of symptoms, Dr. Devin, like a lot of different things. And it makes it sound like breastfeeding or breast milk is like the magic elixir of health. Is that one of the standard questions that you ask for every new client, new patient that you have? Is were you breastfed and were you delivered vaginally or C-section?
It's not something that I ask every single time, but particularly for my clients who are experiencing something that looks like they're in a depleted state,
Okay.
or they're experiencing immune struggles or digestive struggles. It's more like a customized thing that sometimes it will come out, but yeah, most times when I ask the question, there's something that didn't happen.
Okay.
Whether it be vaginal delivery or breast milk was not given at all, or it wasn't given as long. The formula was introduced at an early age, and that's another discussion too about which formula do you give, because not every formula is created equal. So you still, if you do go that route, you still have to find one that, again, your baby is tolerant to.
Okay.
Because that's, depending on which formula you choose, you're now introducing other components that the baby wasn't going to touch until they were older, had they been breastfed for 2 years. And so the immune system is sensitive in that way. So for some people, if you introduce formula at like 2 months old, there's a higher chance that that child may become allergic to milk and soy later on, because you introduced it too early for their immune system at 2 months old versus something like 5 years old.
Okay, that makes sense. I did want to double back with the C-section. So I actually read this one time, I heard someone say this, and I thought it was odd but brilliant. So if you guys know a mom who has to have C-section for whatever reason, or a pregnant mom, I'd say have this discussion with them ahead of time. What the person said was that it was like a mom and dad who were trying to have a vaginal birth, and she had to be rushed to doctor, have a C-section. He was a physician. I don't remember what kind of doctor he was, but he's a physician. And basically, as soon as the baby was delivered via C-section, what he did was he took some gauze and he swabbed his wife's vaginal canal with the gauze, and then he swabbed it all over the baby, in the baby's mouth, around the baby, like every part of baby's skin, so that the baby could be inoculated with the flora, the bacteria that it normally would have coming out of the vaginal canal. And of course, my first thought was, right, because it just sounds weird, but it actually was very brilliant, because again, a baby, its first introduction into the world is through the vaginal canal. And so making sure that you give that baby the best chance of health in the future is gonna be critical. And one way to do that is to make sure that their skin, their body is coated with the bacteria that it normally would have gotten coming out of the vaginal canal.
I think that's a great idea. I didn't get disgusted actually at all. But I was just like, oh, that is great. Great idea.
I don't know that it was, I think it was more of a image. Like I just saw him take, wet the gauze and then just shove it in her vagina real quick, and then shove it all over the baby real quick and in the mouth and around and it was more of a shock because I'd never heard that before. But then I realized like that reminded me of how important vaginal birth is, just in that regard. Like it's just brilliant. It's a brilliant design. like so many different pieces that we don't think about fit together brilliantly. Yeah. So okay. Um I'm trying to remember. Oh, one of the things I wanted to ask you, you had talked about, the things that you see in your office. Ooh, it is hot in New Orleans. The things that you see in your office. Um, if you find that someone is depleted, and they did not, they were either delivered via C-section, or they were not given breast milk, or some combination, is that able to be healed? Is that able to be repaired?
So a lot of the clients that come to me, they are a mix of the uh, GI symptoms, low adrenal function, their hormones are out of balance. And so through the things that I do with them, yes, I'm able to help them to rebalance their systems. At some point during all of that, yes, I am implementing probiotics. I think that through everything I do, I am able to help restore some of what was, in fact, never given.
Yeah.
I do think that, now one thing that I will say is that in addition to what I've seen with the clients that I have, they tend to be individuals who are more on the sensitive side as well.
Mm-hmm.
And so I also try to help them from that standpoint too, because that's not every single child. But when you, I think, don't supply a naturally sensitive individual with what they need, sometimes that can be harder on them. And so we work through, it's a very comprehensive thing that I have to do with those types of individuals. However, I'm very what's the word? I'm very ready for it, because I see it enough times to where I'm like, okay, we got to do all of these things. And then, yeah, they start to feel better pretty quickly, just because I know the different factors that they're dealing with.
Right. Okay. Now, about back to breastfeeding, we know that the baby almost immediately, like when baby is born now, especially, um, doctors, nurses will encourage the skin to skin contact, because they realize how important that is to actually touch the skin of baby with mom. And very shortly thereafter, baby will be put on mom's breast so that they can start to feed. I know that you've had conversation with lactation consultants. Do you have any um, recommendations on ways to make that process easier? Like, when in your conversations with the consultants, have you gleaned any information about that from them?
So one of the big things, there's two things I'll say right now. One is that I hope those who are watching are not just mothers, but also to be mothers, because there's a lot to be done before you have a child when it comes to getting your body ready for pregnancy and also for lactation.
Mm-hmm.
And if you are a mother and you know other mothers to be, please forward this to them, because they need to hear this now.
Yeah.
And so one of the things that came out of working with a lactation consultant for one of my clients is that I realized a lactation consultant is needed before you even get into the delivery room. So what has happened to two women that I know is that they were not even, the doctors did not put the baby on the mother's breast right away. They gave them the bottle. And when you do that, you already start to make it difficult for the baby to latch onto the breast. It's important that they start with the breast so that they understand what that feels like and they're not getting used to the bottle. And so there's other things, of course, that a lactation consultant can go deeper into, but just that was one of the things that really stuck out to me, is that she knew all the different things that you have to be mindful of and talk up about when you finally get into that delivery room.
And
So,
I'm sure that if a mom also has a midwife and or a doula, that those types of conversations will probably come up as well. So again, those of you who are watching live or the replay, if you know someone who's pregnant, if you know someone who is thinking about pregnancy, if you know someone, just keep that information in mind, that lactation consultants, midwives, doulas, these are all very important. Um, these are all very important people to have in on the healthcare team of a family. I don't want to just say mom, but a family that is preparing to welcome in a baby. And I say a family because it's important that the other parent also knows and understands these things, because that is going to be key to help support the mother during that time. Breastfeeding is not the simplest thing. We think that mom has a boob, mom has milk in the boob, baby is hungry, there it is. But it's not always that simple. So having these people on your team to educate you, to support you, to remind you of things, to let you know what you need, what you don't need, to advocate for you is key. And you want to get those things on board as much as possible before the baby is even here, so that it's not, excuse me, it's not a shock, a surprise, or a burden if these issues come up once the baby gets here and is breastfeeding or needs to feed.
right. And I think it's also something to keep in mind. Are you ready for this? If you're not a mother yet, are you ready to support your child in this way?
Yeah.
Are you ready to give your child the best that is available, which is the breast milk? Are you ready to do the things that you need to do so that your body is optimally functioning? Are you ready to change so that so that the milk that you provide your child is acceptable to the child? So that's another thing where your diet may have to change because your child is allergic to something that you're eating. So for instance, if a very common one would be gluten. There's a lot of babies who are sensitive to gluten. There's a lot of babies sensitive to dairy. And so if you notice that they're breaking out all the time, or their poop is not as, it's not the same, then you may have to change your diet so that they are better. So you have to ask yourself if you're ready to commit to that as well. And yeah, when you are in contact with your child, that is a bonding. What's getting released is oxytocin, and that is a bonding hormone. And so we are very social creatures. I think a lot of times we're trying to always tell each other, you can stand on your own 2 feet, you're all that and everything. And that's true. But at the same time, we are social creatures, and most of us in some form need other people. And I think that's even, that's at a much higher rate when we are babies. So as much as you can be around as parents, not just the mother, but also the dad, and having skin to skin with the dad, all of that is letting the baby know they're supported. And when we get into what I mentioned before about anxiety being associated with low prolactin, that can be going back to from a very long time ago, and feeling like you have a lack of support. Where did that start? And so when we talk about having the bonding to the mother and having the bonding to the father, that's one of the first avenues that they feel support, and they feel love, and they feel connection to someone.
Okay. Speaking on baby's response and mom having to change the diet, some of the things you mentioned gluten as one. What was the other thing that you mentioned that mom might not be able to consume?
Dairy.
Dairy. I heard strawberries sometimes. I know eggs can be a thing. So anytime you are feeding your child breast milk, if your child does have a reaction, and that can include as well, she mentioned the breakout. So, little baby acne, uh, that can be colic, that can be eczema, that can be, as you mentioned, Dr. Devin, bowel movements not quite right. All of those could be responses to food. And if baby is not eating food, they're exclusively breastfed, then mom, you will have to look at what you're eating and possibly remove some things from your diet, add some other things to your diet so that your baby is not responding to what you're eating, because that's not uncommon that happens. So just keep that in mind, that if a baby is responding poorly in some ways, a lot of things could be depending on what mom is eating. So yeah, I wanted to make sure that we talked about that a little bit more, or at least I brought it up a little bit more.
Yeah, and I think that's important because you mentioned strawberries, and people might think, gluten common, dairy common,
Mm-hmm.
but strawberries might be of a shock to people because it's a seemingly healthy food.
Yeah.
But reality is, and I had recently did a Facebook Live on this as well, is can you negatively react to, per se, healthy foods? And the answer is yes. People can be allergic to anything.
Yeah.
So sometimes it can take time to figure that out. And I was a child like that, not so much through breastfeeding, but after breastfeeding. I had skin problems. I had eczema and atopic dermatitis, and I just was breaking out. And for a while, my parents were just not sure what it was. And so my mom took the time to give me things one by one.
Mm-hmm.
And slowly we found out the things that I was allergic to. So in some cases, you may have to pull back on things you're eating, simplify what you're eating so that you can track what your baby might be sensitive to.
So let's talk about how to simplify a diet. So if a mom is noticing that a baby is having these responses like baby acne or colic or eczema, or changes in stool or changes in mood or something like that, and they're thinking that some of it might be because of what she's eating, how would you recommend that she pull back on some of the things in her diet, um, and then reintroduce things slowly? Because I mean, breastfeeding is already tough. Having a little kid is already tough. Um, and so, to try to figure it out, especially on one's own, is just adding another thing. So what would be your recommendation in how they can consider doing that?
So one thing to keep in mind is that when people have food sensitivities, they may have more than one.
Mm-hmm.
And so to say, I mean, you can start off very simple and just eliminate one food and see if that makes a difference. But if it doesn't, then you may have to eliminate more than one food. So when I implement different dietary changes with my clients, there are a set of foods that I pull out because they are common food sensitivities for a lot of people, whether they know it or not. And so that would be gluten, dairy, soy, corn, um, sugar, and processed foods in general. If I think,
Eggs is one for me.
yeah, eggs is
That I
actually
usually,
another common
yeah.
one. Yeah, I try, and I don't pull it out right away, but I am often asking, particularly with my digestive clients, I'm asking how often do you eat eggs? Because one of the things that I want them to start doing right away is rotating their food. So if they're eating eggs every single day, I'm like, pull that back to maybe like once a week.
Mm-hmm.
Because if we're not doing a food sensitivity panel, I need to find out if you're allergic to eggs. So like, for instance, one of my clients recently, she was nauseous before lunchtime. So I'm like, And so I asked her, what are you eating for breakfast? And it was pretty much every single day she was eating eggs. So that's why I was like, okay, we're going to have to pull that back because I need to find out if that's why you're nauseous. But before lunchtime. So that was an interesting dynamic
Yeah.
there. And again, with food sensitivities, that can have a delayed onset of a reaction. So if you don't react when you're eating it, you can react a few hours later, even a few days later.
Right.
So.
Right. Okay. So yes, food sensitivities. Yes, it is very important to reiterate that if someone is responding negatively to a food, it's not always an immediate reaction. So it might happen some hours later. You eat something for breakfast, and then in that evening, you feel a response. It could be the next day. It could be up to 3 days later. And so when Dr. Devin says to remove the food and eat it only 1 day a week, that's because if that's a food that is responding 2 or 3 days later, you've cleared it for 6 days, and then you have it again on day 7 or 8, so that you're not responding, as soon. And you can see, all right, I had this on Monday. Am I going to be responding negatively on Wednesday? That gives it that amount of time. So that is why that rotation is important. What do lactation consultants do?
So they help with dealing with pain, nipple pain. They help with milk letdown, which is also something that I help my clients with. And they help with the latching on of the baby to the nipple. That's kind of like the three main things that I am aware of. A lactation consultant would probably go much deeper into all of those.
Okay.
But all of that is important because you want to make sure that this is, if it's just pain, there's different ways around that. You don't have to just kind of, grin and bear it. And lactation consultant can help ease that for you.
Okay. We know that there is some moms, there is sometimes an issue with mom not producing adequate amounts of milk. What are some of the things that you talk to your clients about in that regard?
So the first thing is the diet. So if it's not very nutritious, I'm doing an overhaul and just trying to make sure that they're on a good, healthy diet. This is actually not the time to detox because whatever you're detoxing from, it goes into the baby. So this is not the time for that. It's more about maintaining getting on and maintaining a healthy lifestyle. So first off is supplying your body with adequate nutrition because that helps everything to function better. It's also about drinking more water. So if you're not drinking enough water, it's going to be hard to produce this watery based thing called milk that comes out, right? And then considering adding electrolytes to it, again, that's supplying more minerals that the body needs to function in every cell of the body. And then there's the herbs. And so when you were mentioning colic, for instance, one of the herbs there's a class of herbs that's considered galactagogues, and that means that they help to increase breast milk. So one of them, for instance, is fennel. And when you're talking about colic, what I like about herbs is that they do all these different things. It's not just one thing. And so that can be helpful when you're thinking about what herbs might work well for you and your baby. So fennel, for instance, helps with decrease in spasms. And it's a galactagogue. It's a phytoestrogen, so it can help moderate estrogen levels within the body. It relaxes spasms within the GI tract, and so that helps, again, with colic in infants. Colic can be this stomach discomfort within the GI tract of infants. So fennel can be helpful for helping to relax their GI system.
The cool thing about fennel, the cool thing about a lot of these is they're not hard to find. Like fennel is one of those herbs that you can actually find in some grocery stores, right? And so, and it's like different parts of the plant that are used. But if you're trying to increase your milk production, then you can use the herb and you can also eat the food. Learn, some recipes that you can add that into your meals so that you're eating nutritious food that will also have an effect in helping you produce breast milk. So, buy a bulb of fennel and cook it in your meals, along with getting the herb and either, drinking it as a tea or using it as a tincture or taking it as a capsule, however you decide to take it. What other herbs do you like for this?
Moringa is a very well-known one for milk production, so I do tend to add that in. I don't rely on it just by itself. For some people, that's all they need, moringa, and they're good. If they had breast milk production, for some women, they do that and then they're good. One thing that I didn't mention also was bone broth. Again, that supplies a lot of nutrients to the system, and then thus that can help with milk production. But another herb is oat straw. So that comes from oats, also known as avena. It helps with milk production. But the other things that it does, going back to what we were talking about before with feeling depleted, is that oat straw helps to restore and build back up the nervous system. So it's particularly good for states of depletion or states of nervous exhaustion. It helps to restore normal function to a weakened, exhausted state. So then we're getting in, and then it's also just calming in general. It's a very nutritive part of the plant. So we're not talking about like the oatmeal that you eat. It's a different part of that that plant.
And it's not processed.
Right. So that's another one that can be great. And again, when we're talking about herbs doing different things and how we are looking at the individual, if you're somebody who's depleted, then that may be something that you really need to address to get your milk production to come back up. If you're somebody who deals with a lot of anxiety, avena or oat straw might be a good one for you to have. So you're addressing different things that are going on with yourself that also will help to improve your milk production.
Two of the herbs that I really like, along the same lines as the oat straw, are alfalfa and stinging nettle. And you can find these at any herb store, right? Because they're very common herbs, but these are also two very nutritive herbs, meaning that they have the minerals, they have the nutrients that will help to refill you, that will help to nourish you, mom. And as they're nourishing mom, as mom is being built up and nourished, baby can be better nourished. So, and that will allow mom to, to produce more because you're increasing your building blocks, the amount of building blocks that you are taking in. I like using teas. So the fennel, the oat straw, the alfalfa, stinging nettle, I like to use teas. Do you mostly use teas for moms, or how do you normally have them take the herbs?
So most of the ones that I've done so far have been more in capsule form. They have them all set up because it's designed in such a way to help increase milk production. So I usually find those, and all of that tends to work well. Now, if somebody specifically asks me, look, I'd rather do a tea, then I would show them how to do a tea. They want a tincture, which would be like I would make it out of only glycerin. And then they could have a liquid form or besides tea, there's also the type of thing called a tincture, which is herbs preserved in a substance like glycerin, which is more of a sweetener. And they can take that, and that could also help with the milk production. So it's more about what the mother, what form the mother wants and what they're willing to stick to. So of course, if we're having a mother who's doesn't feel like she has a lot of time and she's working and everything, she may prefer the capsules because she can take it wherever she goes.
Okay. What would you want a new mom or mom to be to come away with in this discussion today?
This conversation is actually important because for me, because the way that I got into specializing with gastrointestinal disorders is because I was diagnosed with irritable bowel syndrome at 21 years old. And my history was, yes, I was vaginally delivered, but I was not breastfed for too long because my mother's milk dried up, meaning she stopped producing breast milk. There was nobody around to say, here's what you can do to get your breast milk to come back.
Yeah.
And so for me, one of the things that I'm big on is exposure. So know that there is a way to increase your milk supply. Know that there is a way to help better deal with nipple pain. Know that there's a way to help your baby to latch on better so that they can actually get the milk out of the mother's breast. There are ways to help your intention for breastfeeding to go smoothly and to be successful. And if you weren't thinking about it before, I hope that now you realize how important breastfeeding can be. And I think we have to be careful with these ideas. Well, I didn't get breastfed and I was fine. Well, you're a completely different person than the person that's about to be birthed out of you.
Yeah.
You know, so keep that in mind, that what worked for you is not always going to work for somebody else. And if you have the opportunity to give them the best that you can in the form of breast milk, then do that.
Yeah. Thank you. Thank you for that. And I would want to make sure that that mom to be, new mom, knows that whatever your decision is, it's okay. Just to make sure that you are getting the most information, making the most informed decisions that you can. If you cannot breastfeed for whatever reason, don't feel horrible about it. Again, just make sure that you have all the information that you can, so that you can still do the best for your baby and set your baby up for the best outcome. Because literally, the best thing is baby came out of you, the food should come out of you as well. But things happen, things arise, things definitely happen, and sometimes we cannot avoid it. But there are things that we can do. Getting support, like I said, a midwife, a doula during your pregnancy and birth, a lactation consultant prior to giving birth, so that they can give you some education ahead of time. All of these people can be advocates for you, so that you are not the only person trying to speak up for yourself in a very critical and vulnerable time. And you can get the support that you need when things arise, because they will come up. Who knows what will come up, but things always come up. And that's just life. But just being as well informed as you can, or at minimum having people around you who are well informed, because even if you can't get all the information, you want to be able to contact someone that has the information that can help you out. Breastfeeding is so important, and it's not just, giving a baby a meal right now. It is literally setting them up for the best outcome later on in their lives. And it really does show up. You may not have heard this before, but that's probably because if you hadn't heard this before, it may be because you hadn't been in contact with doctors who look at health in its totality. So just keep that in mind, and good luck to you guys. Dr. Devin, if someone wanted to contact you, and someone wanted to reach out to you, contact you, how can they do that?
So I offer telehealth consultations, and they can reach me through drdevinmiles.com. Devin spelled an I, and they can also call 281-231-2811. I am on social media, Twitter, Facebook, Instagram, at drdevinmiles.
And I am Dr. Turshá Hamilton. I can be found at my website, www.drturshá.com. On all the social medias, I am more prevalent on Facebook and Instagram, but you can follow me on all the social medias at Dr. Turshá, DrTursha. Be sure to share this video. Breastfeeding and lactation is not a sexy subject, but it is a necessary subject Again, it sets us up for the rest of our lives, and literally it affects every single one of us. So share this information, and be sure to follow Indies of Color on Facebook and Instagram. There are a lot of naturopathic doctors who have a wealth of information in so many very different situations, areas of medicine. So be sure to follow Indies of Color on Facebook and Instagram. Let us know if you have a topic or a question that you need more answers for, and we will do our best to connect you with the doctors that can help you. And we may even make it a topic for the Indies of Color discussion. Thank you all for watching. Thank you, Dr. Devin, for being here. I appreciate you. Thank you, Dr. Jameelah, for trying. You know, like I said, things happen, so be it. Dr. Crystal, Dr. Kalina, we wish you and the mom that you're helping to bring a new baby into the world all the best. And we'll see you all next week. Take care.